Welcome to another episode of the Your Company Health Podcast. I'm your host, Andre Wright. Today we're talking with Dr. Ben Mcdowell. He's the owner of Mcdowell Chiropractic, and he's actually the youngest president of the Georgia Chiropractic Association. It was an exciting discussion about his practice and what he's doing for the community. Let's dive right in and take a listen. Welcome to another episode of the Your Company Health Podcast, brought to you by my new book, Visibility. You can get it at Amazon or go to my website, andreewright.com. Dr. Ben, how are you?
If I was any better, my name would be Andre Wright. That's how good I am.
Oh, man. So to get things going, I want to tell our audience about your story and how you started in chiropractic.
Well, that's a great question, Andre, and I'm glad you asked, and I'm happy to share it. So I grew up playing just about any sport that you could get your hands on, and the last one that I picked up was one I had no business being a part of, which was football. For those of you who are listening and not looking, I'm 6 feet tall and I weigh 165 pounds, and so I'm not exactly built like a football player ought to be. And I'm 35 years old now, but when I was 14, I probably weighed 110 pounds soaking wet. And so I had no business playing football, but you couldn't tell me nothing. So I got to playing. And after a couple of years of getting absolutely beat up on, one time a defensive end just absolutely hammered me. And I immediately felt as though somebody had stuck a butcher's knife in my back and started ripping it down my leg. And it felt like it was on fire, pins and needles. It was just terrible. I couldn't stand, couldn't walk. I didn't know what was going on. I was very scared. And my dad had to come pick me up off the football field and bring me into his car, threw me in the back of it. He turned around and he said, "We're going to the chiropractor." And I remember thinking, the hell with that, we're going to the hospital. I'm dying. But I'm glad that he did. He took me to his chiropractor. Chiropractor examined me, took some x-rays, showed me what was going on. And he looked me in the eye and he said, "This is something that I've helped many people with, and we're going to help you with it. And you're going to get back to walking just fine. You'll be back in the weight room. You'll be back playing football next season. You're going to be okay." And I remember thinking, this guy is crazy. No way, no how. When you put me on the surgical table, get me operated on, because this is terrible. My life is ending. Well, sure enough, he laid me on the table. He gave me that first adjustment. And without thinking, I stood up. I still felt terrible, but I remember thinking, "No, wait just a minute. I had to get carried in here, and now he gives me this something, and poof, here I'm feeling a little better and I can stand." And I remember thinking, this is special. Something about what just happened here is otherworldly. And I looked at him and I said, what just happened? And he started explaining it to me a little more. He said, "Well, like I just told you, here's what happens." And I remember thinking, this is it. This is what I was put here to do. I thought I was put here to go into the professional baseball realm, but that obviously wasn't the deal. So I was put here to be a healer, and I found it out right there, August of 2001. And that's where the chart was set, the course was set, and it's been chiropractic ever since. And I was 14 years old. I'm 35 now. So now I'm living my dream, got into chiropractic school, got out, went into practice for another doctor for 4 years. And then he told me he thought I was ready to start my own practice. And so I did. I signed the lease April 14th of 2017 here. And I opened up my doors June 26th of 2017 and have been having a fun time ever since. And so as the old radio guy would say, that's the rest of the story.
And that's a fascinating story. There's always that aha moment. There's something that tells you that this is the direction that I'm going. What's your process like? I come in as a new patient. What should I expect?
Well, that's also a great question. It's almost like you've done enough of these interviews to know how to ask the right questions there, Andre. So I would say, let's not put the cart before the horse, as the lawyers would say. And let's start off by addressing some things that your average Jane Doe or John Smith is thinking or feeling. And what the truth of the matter is the average person in America feels as though they don't like to interact with the healthcare system. They feel that they're given poor service when they do interact with the healthcare system. They feel as though their physician does not communicate with them in a way that they understand. They feel talked down to. They feel that it's hard to access good healthcare, meaning if you call in on Monday at 10 a.m., the first available appointment is Monday at 11 a.m. next month. But they're having a problem now. The other thing they find is that there is a great deal of the opposite of transparency, opacity in the healthcare consuming experience. Meaning, if you go in and you want to know what's my bill going to be at the grocery store, the price is right there. But if you go to the doctor, well, yeah, your copay might be X or your deductible might be Y, but then maybe a month later you get a surprise bill in the mail, and now you're having to go to the bank and take a third mortgage on your house to pay off that surprise bill. So people have opted to just say, the heck with this, I'm just not going to go to the doctor because I'm going to get bad experience. I'm going to have to wait 3 months to get into the appointment. When I go there, I'm going to wait 2 hours after my appointment to be seen by the PA, not even the doctor. So I wait all this time, then I wait all this time, and then I'm seeing what they perceive to be a middleman or middlewoman. Now, you and I both know PAs receive the exact same amount of training, but there's just something about seeing the doctor, and people want to see the doctor. If they pay for seeing the doctor, they want to see the doctor. You know, you don't go to the lawyer's office when you want to get a divorce and talk to the paralegal. You talk to the lawyer to talk about your case. The lawyer listens to your case, see if there's grounds for that divorce, you know, if you've got a good case there. And then they come back and say, listen, we've studied everything about this case. You do appear to have grounds for this divorce. Here's the proceedings. Here's what the plan. They lay it all out for you. And then there you go. So the average Joe has a bad experience with healthcare. And then if you add on to chiropractic, the perception in America is that chiropractors are too expensive to access, meaning people think that it's way more expensive than it is, when the truth of the matter is the average visit to an orthopedic doctor to get established is $500. The average visit to your primary care office to get established is $200. And an average visit to a chiropractor in the United States is less than $100. So perception is different than reality, but that's the perception. So that's a barrier. There's also a perception that chiropractors, for whatever reason, are greedy. And well, I've not found that to be the case, but again, that's perception. So you can't fight perception with anything except experience. And so the other thing is a lot of people don't like chiropractors because it's hard to get into them because we're perceived to be only open every third Tuesday, and forget about Thursdays, nights and weekends. Don't even think about it. You got 2 hours here and 2 hours there, and you pick. The other thing is they don't like that chiropractors don't accept insurance, and that's a different decision based on the individual. It's like Forrest Gump. You never know what you're going to get. So every time you go to a different chiropractor, you don't know what you're going to get. And you don't know if you go there expecting chiropractic, but you might be said, well, you need these orthotics and you need these exercises and you need these supplements and you need this diet program and you need these, this, and just they call them the add-ons, or you need this specific pillow, or you got to buy this CBD cream or whatever have you. So there's a lot of fear and anxiety when it comes to going to the doctor. There's a lot of fear and anxiety and distrust when it comes to going to a chiropractor. So people often just say, I'm not going to do anything. I'm just going to wait it out and hope it gets better. And the end result of that is that this country is currently experiencing an opioid crisis, meaning people are getting addicted to pain medication. It only takes 3 days to get addicted to that stuff. Mm-hmm. And 130 people die every day in this country from correctly prescribed pain medication. That's not people that are just getting it on the streets. That's people that are getting it from their doctor, but it has a reaction, they overdose, and poof, that's it. Now they got a family that's left holding the bag. They got kids. It's a mess, and it is truly an epidemic.
It is a mess. So you spoke about the distrust with chiropractic versus, your general practitioner. But why is it so though? Because from my understanding, a chiropractor works on your central nervous system, right? And that links to basically everything in the body. So I would think we would gravitate more to a chiropractor. That's like preventative care. So is the case of marketing, or why there is that distrust in with chiropractic?
So that's another good question. And there's two reasons for that as far as I can tell. Number one is if I'm speaking to you and you're speaking Spanish back to me and you don't understand English and all I'm speaking is English, you're not going to understand what I'm saying to you. Now, I might understand Spanish, but if I can't speak Spanish back to you, the message is lost.
Yes, that's true.
Because what I'm saying in English, you can't understand in Spanish. Now, if I'm able to speak Spanish, then you understand what I'm saying and I understand what you're saying, and we can communicate back and forth and we understand one another. In my opinion, a lot of chiropractors, we've paid the equivalent of a nice house to get educated, and we like to flex that education muscle. And so we use all these big 25-cent words to explain something that's rather simple. And if I try to explain something using language that someone doesn't understand, then they're going to think I'm talking down to them because I'm using language that they don't understand. They think I'm doing it on purpose to act like a real smarty smart pants. When the truth of the matter is, if I use language that relates to them, that they understand, then they understand it easier. So if you're a mechanic and I say, it's kind of like when someone comes to you and their engine's knocking and they haven't changed their oil and the oil pan's dry, or you see metal shavings down there, there's some evidence of some long-term wear and tear in there and lack of preventive care. And they're like, well, that makes perfect sense. And I say, so you see this problem right here? See this is the equivalent of metal shavings on this x-ray. I can see that. And that tells me this has been progressing for a number of years. And that's why this problem has gotten there. And that's why it's going to take us some time to unravel it. And they're going to go, oh, that makes perfect sense. So if we can communicate with the patient in a way they understand and respect them and take time to figure out how are they going to understand this and then communicate in that way, it shows respect to that person and they understand it. So they grasp it and they internalize it. And it makes perfect sense. Chiropractic is not hard. It's the most simplest thing ever. But if we overcomplicate it, then they default to their understanding, or they Google something and they might see something that's not good, or they might say, well, that doctor's just trying to be a smarty pants. That's the number one thing. The number two thing is I believe that chiropractors have lost sight of the power of chiropractic, and they've become down on their profession, not realizing the power that they hold in the education and what they can do to impact lives, or they may get focused on declining reimbursement or whatever. And they'll say, well, you can't make it on chiropractic alone. Well, in my opinion, chiropractic is enough. And if somebody needs more stuff, you partner with somebody else that can do that thing and you refer them out for that for co-management. But some of them think you got to have all this other stuff, other income streams into your practice to quote unquote make it, because it's not enough, or people won't appreciate it or won't whatever. When the truth of the matter is, the more things that you introduce in creates product confusion among your patient, and it creates distrust, because then they view you as a snake oil salesman who's just going to hawk any sort of product or service or whatever. Because again, you don't go to the divorce lawyer and they say, well, what about, have you been involved in a car wreck? Or do you have any business disputes? I can help you with a business law thing. Or do you have any bankruptcy? I can help you file bankruptcy. Lawyers specialize. They do their one thing. Even in medicine, the orthopedic doctor is not asking about diabetes. The internal medicine doctor is not asking about an ear, nose, and throat disorder. So doctors are viewed by the general public as specializing. So if the chiropractor is not doing their one thing, they're seen as a jack of all trades or a master of none, and that creates distrust as well. Now, again, that's my theory. I might be wrong, and I have been wrong before, and I will be wrong again in the future, but I believe those two things have contributed to a lack of trust. And if we change those activities and actions, we can create trust and create goodwill in the community, because we do have a great thing. Treating someone naturally is a great thing. Now, if they need other medical services, I believe it's the chiropractor's duty to tell that patient, you need a consultation with other type of doctor, because this is the diagnosis that you have that is treatable by this other type doctor. Because if you don't do that, that's technically, actually it is malpractice, and that's not what's best for that patient. So you should be able to have a community of other physicians around you that you know, like, and trust, that you can refer your patients to for those other services. So it's a multifactorial approach, much like when someone comes to you and says, hey, I want to do some marketing. You say, well, that's good. I'll help you with the digital aspect of your marketing, your SEO, your website, your posting on social media, but you also need to do community outreach and networking. You also have to have a good website. Maybe you want to do some billboards. Maybe you want to do some radio ads, maybe television ads, maybe some direct mail. There's a lot of aspects to marketing that create a holistic marketing plan. It's not just one thing.
Exactly.
So
it's not
treating the person holistically at the chiropractic office is very similar.
No, it is, you have to, as a chiropractor, it's all about a tailored approach to each patient. It's not just one size fits all. So, doctor, I wanted to talk about your technique as a chiropractor, because I've spoken with all the healthcare or practitioners or chiropractors where they're saying, Andre, I don't do this, I don't do that. This is what I do for the patient. So I want you to tell our audience, what's your technique?
That's a great question also. And I can see why a lot of other chiropractors would like to focus on that. But I would say when I call my handyman and I've got a problem where I want to get that diploma hung on the wall so everyone can see that I got Dean's List at Life University, or that one over there that's got my Eagle Scout certificate on it. Well, I just got a problem. I want to get it hung on the wall and I want to get it looking level and square and I want it to look nice. Mm-hmm. Now, when the handyman comes in, I don't care what the drill bit that he's using. I don't care if it's a Makita drill or a Milwaukee drill or whatever. I don't care if it's a 1/8 by 2 inch long drill bit. I don't care what, just, can you please hang that? Can you get it square? Can you get it level? And I'm happy. So in my opinion, what the consumer of the healthcare product, in this case, chiropractic, wants to know is not so much how we do what we do, but why we do what we do. And why I do what I do is to serve the humanity and to change the healthcare of this country and to save the United States of America $1 trillion per year on healthcare costs by serving people in a way that is easier for them. So what does that mean? We're open 6 days a week. We're open early. We're open middle of the day. We're open late. We're open weekends to make it easy to access an appointment. So when somebody calls in, let's make you an appointment. We tell them straight up, it's probably going to take this amount of time. I'll tell them straight up, our first appointment is no more than $40, and we're going to donate 100% of that to our charity through our Give Back movement. And I tell them straight up where it's going, tell them what the cost is. Once we sit down and have a chat with them and figure out what it's going to be and what the problem is, they're going to have excellent service from the minute they walk in. They're going to be seen at their appointment time. So these are all things that are best for that patient. If they have insurance, we file it. If they don't, it's no problem. We set our fees at what is considered Medicare reasonable and standard, which means that even if they don't have insurance, it's not going to break the bank to see the doctor. And whether they have insurance or don't, we bill out the same fees. So there's no dual fee schedule on that. So everything that we're doing is aimed at trying to give good service and a good experience to the patient, because they have a problem they want solved and they want to make it easy to solve it. They want to make it to where it's not going to take a lot of time, and they want to know how much is it going to cost. So we estimate what it's going to cost so they can figure out if they want to invest that into that. Just like when you go to the grocery store or buy a car, the price tag's right on it so that you can figure out, do you want to buy that car or that car? You want to buy that milk or that milk? Everything should be transparent. So it doesn't really matter how we deliver that product. It matters the experience that we deliver that. And that's what I focus on, is making sure that person feels that their time is respected, that they're given a straight answer, they're spoken to with respect the whole time, their time is respected, they're in and out. It's not going to take an hour when you're here. Yeah, the first time it might take a while, but once we figure out what's going on, you're in and you're out, you're taken care of, you're on about your business. It's not going to be this, and this, all these services. You're going to get chiropractic care when you come in. And then if you need other stuff, we're going to recommend other professionals that do provide that other stuff.
That's a fantastic approach in terms of the customer experience, because you spoke about the misconception of a chiropractor where people think they're too expensive and all that. But I've seen, firsthand where chiropractors are like, hey, I don't take your insurance. So, and the next step is I'm going to have to pay that extraordinary amount of money. But I like your approach where you work with the client and you try to come up with a solution.
And that's the other thing. There's a zillion other complaints people have about chiropractors. I could go on for days about how I want to change things, and I am going to make sure that we start from ourselves and move outwards. But another one I hear a lot is, well, I don't want to have to be locked into something and pay up front for all this. No, you go to the grocery store, you pay for what you get that day. Well, at my office, you pay for what you get that day. And if it's not working, we stop. There's no long-term contract. Anyway, again, I could go on for days, but the moral of the story is I specialize in the experience. I specialize in trying to figure out, put my shoes in, what does the patient want and need? What are they going to appreciate? What's most valuable to them? Time is the first thing. Speaking plainly with the patient is another thing. Understanding what to be done, what's going to happen, whether they need a referral out. So the experience of consuming the product of healthcare is a good one, making sure that they feel respected. And you can see that if you look at my Google reviews, I've got the third most Google reviews within a 10-mile radius. My favorite type of person to take care of is someone that's had a god-awful experience at another type of doctor, because their wall is up. They're distrustful. They're unhappy. This is going to be terrible. They're angry, and rightfully so. Like, whatever happened, they shouldn't have been done dirty like that. But when they come in and they're greeted with respect on the telephone, with excitement, they're offered an appointment quickly. They come in, they're seen at the time that they are appointed. They come in and they see me and they're happy, and they ask me a bunch of questions, and I don't rush them through. I answer their question. Does that make sense? Let's go over a little more in detail. Let's test it and see what's going on. Let me take some time to figure out what's going on. Let's make an appointment to come back in a day or so once I've had some time to chew on this and absorb it a little bit and put together a plan. Then we sit down and talk about the plan. Here's what I found. Here's what's going on. Here's what we propose to do, or you need to go to this other doctor because here's this problem that you got going on. But that's my favorite thing, is when I hear that of, man, I've had some bad experiences other places, and I was very hesitant to come in here because I was worried it was going to happen again. But here we go. It makes sense. It's understandable. It's affordable. It's laid out. And yeah, let's go ahead. Let's rock and roll. And again, I ain't perfect. I can't help everybody. Some people, you start them under care and they don't respond like you want them to, or like they deserve to. And you just say, hey, listen, we gave it a try. It didn't work. I think the next step is you need to talk to this other doctor. And you can't help everybody, man. Off the bat, you can help some, but some you think you can and you can't, but you have to be able to look them in the eye and tell them this ain't working. We need to stop. Let's go find another type of person that can help you. Here's some people I have as suggestions. Let's try this other thing instead. So Great. Just treat them like you'd want to be treated. It's not difficult.
Oh, great. And that's all good. That's all good, Doc. And I think your approach is excellent. I want you to talk to our audience, because I know you, I think part of your process, you mentioned that for every first visit, you donate it or you give it to charity. Talk to our audience about that.
Man, that's an exciting part of this practice. My old practice I worked at, the doctor, before I even started with him, he said, this is what we're going to do. And he took every single penny of that first day appointment and donated 100% of it to charity, not a portion of the proceeds, not the profit. No, if someone pays $50, he donated $50. So I asked him about it, and I was like, well, I love supporting charity too, man. But I mean, you're giving away basically what you're doing on that first day. And he said, well, listen, Ben, you're seeing it kind of short-sighted. And the truth of the matter is I was young and dumb, didn't know what I was talking about. He said, the truth of the matter is there's some great charities here in this town that we live in. And it is a great thing to be blessed to bless others. And these local charities often don't get the big donations that the big national charities like Red Cross does. And we might be the only donation they get. And you never know what that charity is going to be able to impact someone's life, and not give them a hand out, but a hand up. So he said, I encourage you to look at this as an investment in your community. Don't look at it as what you're losing or spending. Look at it as an investment. And frankly, every one of your patients likes to donate to charity, or they ought to like to donate to charity. So they like that their fee is going to help somebody in the community that they live in. They like that. And I like it too, because I was born here, raised here. I like supporting my town. And I think this is a good way to do it. And I like it. And I'm happy to tell people that we do it. I'm happy to tell people about the mission of our charity, because maybe they're looking for a place to donate, and you never can tell. Maybe that person sees that and they donate personally, or their church donates personally, or their business donates. Who knows? You never know the impact that's going to make. So that hit me like a diamond between the eyes, and I felt pretty sheepish about questioning about it, if I'm being frank. But I said right then and there, I'm doing this when I start my practice. So here in Roswell, I've donated to many different charities through our Give Back movement, which is a nationwide group of chiropractors, about 6,000 of us, that all donate our first visit fee to our town's good charity local. So here this year, in the past 2 years, we've supported the Esther Jackson Community Foundation. So if somebody comes in and sits down with me and talks, and I figure out what's going on, I tell them I'm taking this first visit fee that you're paying up front, and I'm going to donate at the end of the year to the Esther Jackson Community Foundation. And they're going to do things like they're going to buy shoes for the children at Esther Jackson when they go back to school, so that nobody has to feel like the poor kid in school. They've all got hot, new, cool shoes when they go back to school. Then at Christmas, there's going to be some families that this foundation is going to support, and they're going to buy Christmas gifts for all the children so that they can have Christmas. They're going to buy food for all the families so they can have a proper Christmas meal. Throughout the year, they're going to provide financial literacy classes. They're going to pay for if someone's got a rough month and they can't make their power bill in the winter, or if the teachers see a kid that doesn't have a winter coat when they get to school, the foundation is going to go and get that winter coat and deliver it to that child that day. So this is a tremendously impactful charity right here in Roswell, and I am so proud to support them. And it was a tremendous I'm telling you, man, last year, right around Christmas, they contacted us and they said, hey, we've got this shortage. We've got all these families that need Christmas, but we don't have enough money to do it. I said, what do you need? And they said, well, we need this much. And I looked at what we had done over the year, and I said, well, I've actually got a little extra for you. So I told y'all I've been saving this all year. So here you go. And I wrote them a check, and it covered the shortage and then some. So they had a little extra to start the next year. So I encourage any chiropractor that's out there listening, join me on the Give Back movement. Find a charity that's in your community and take your first day fee and donate it to that charity. Don't look at it as what you may be spending or losing. You're not losing anything when you're donating. You can never outgive, in my opinion. Right. And you never know what family or person is going to get impacted by that donation that you're giving to them. Every time someone comes to my office, it can feed a family of 4 for 2 weeks on that first visit donation. It goes a long way.
Awesome, doctor. That's great what you're doing in the community. You have utilized, from what I've seen, you have utilized digital marketing to great effect. Why digital marketing is important to our chiropractor right now?
That's a great question too. And this applies to any person who's doing anything in any type of vertical. Doesn't have to, if you're not a chiropractor or you're not a doctor, you don't have to shut your brain off right now. Just apply it to your thing. In the old days, it took 2 to 5 touches for someone to create brand recognition, comfort, visibility, understanding of what you provide. Nowadays, we're inundated with so much data, it takes about 16 times of somebody seeing what you're doing to even remember your brand.
That's true.
And so back in the old days, you put an ad in the Yellow Pages. Well, the Yellow Pages doesn't exist anymore, but if it did, you would do that. But you didn't just do that. You went to the Lions Club, you went to the Kiwanis Club, you went to the Rotary, you went to the Chamber of Commerce, you did all types of stuff to get out there and to give to your community and make sure that you were seen and people knew about you. Because if they don't know where you are, know what you do, they don't know if you can solve their problems. So nowadays, there's a zillion different ways to get out there. You got radio, you got TV, you got billboards, you got community newsletters, you got magazines, you've got Chamber of Commerce, you've still got your service clubs, Rotary, Kiwanis, Lions, you've got your closed networking groups, you've got your open networking groups, you've got your professional organizations that you can go to, you've got trade shows, you've got digital marketing, which is the newer one in the space, you've got Facebook, Instagram, LinkedIn, Twitter, Pinterest, all the Etsy, everywhere that you can be. Think about the person that has a problem. Where are they going to go and be? Are they going to be looking at a billboard? Are they going to be going on their phone and Googling something? Are they going to be going to their neighborhood website like Nextdoor and saying, hey guys, I got this problem. Can anybody recommend somebody? What are they going to be doing to to find a solution. And if they're not looking for a solution, where are they just going to be? To where if you put something where they see it, that now they see, oh, hey, look at that. That looks like a nice doctor. I don't have a problem now, but if I do, he smiles nice. Maybe he's a nice doctor. I might go see him or her. So the more times that you're in places where they are, the more likelihood you're top of mind if you create a positive impression, if the messaging that you're putting out there resonates with them, if you are solving a niche problem, or if something that you're doing speaks to them, or if you are talking about something that they can understand in a way they understand. So when you asked about digital marketing, well, people are on their phones. They're on Google, they're on Instagram, they're on Facebook. They're looking at pictures of their grandchildren. They're looking at their friend's wedding picture. They're looking at pictures of someone's vacation. They're looking on Instagram or on TikTok or whatever. And if you put things out there to tell people who you are, what you do, what your mission is, what your purpose is, just about your business, a little walk around. Well, here's this gadget that we sell and here's what it does. Or telling a story about someone that you helped, or just talking in a way they understand. It doesn't have to be highly technical. Just put it out there. Anything. And just act like you're speaking to somebody in person. Just act like you're talking to Andre here. Just talk like a regular person.
Yep.
Talk about what you do, talk about your business, talk about who you help, talk about who you partner with for things that you don't do. Just give information. People want to know a lot about what's going on before they make a decision. If they're in, I need to get a problem solved, they're going to do a lot of research in a lot of different ways. And the more information you provide, the more you can see if somebody's going to say, yeah, it looks good, or nah, that's not really my thing. And that's pretty important because not every business serves the same type of clientele.
That's true.
If you can help them to figure out if they're a good client or not, then they can self-select. And if you give them the information to say, that's not a good fit for me, maybe in the future, if someone asks them and they go, I saw a video and it wasn't for me, but it sounds like that might solve your problem. Well, they're a walking billboard for you. And people like to be informative and help other people. And if you arm them with information, they can help somebody else, and that makes them feel good.
And that's perfect.
Don't overthink it. Just put content out there, put information, even if it's like, here's what you're doing today, or here's the place you went for lunch, or here's who you're meeting with. Just show people that you're nice, that you smile, that you are respectful, what you do.
Exactly.
Just put it out there. Put it out
right.
there. Put it everywhere.
Yeah, you're perfect. You're perfectly right. Building the brand. And just to your point, if I'm in an area, I don't know any chiropractors and I need to find one, I'm going to Google it. I'm going to Google chiropractor in Roswell, and then I'm going to see the chiropractors that are coming up. And then when those chiropractors pop up, the next thing I'm going to look at is the reviews. To touch back on your point, is you having a very high number of reviews. So that's really important because this is where people are talking about your service and telling how great you are. So that's fantastic. Your whole explanation of digital marketing, being everywhere and be present. That's what's going to separate you and it's going to promote your business.
The rising tide floats all boats. You got to put in a little bit of good for your colleagues. Don't look at them as competition because no two companies are the same. They don't serve the same people, they don't do the same things. But if you raise the perception of your profession or your trade or whatever your business is, then your colleagues benefit from that. And you're giving back to your profession and you're making it better for the next generation. You're making it better for the guy or girl down the street. And it's good to give to your fellow man and fellow woman. And it's not all about me. You can't be a me monster. Try to look out for the people down the street and make things better for them. Be nice to your clients and be nice to the market. And both of them will treat you well as well.
That's well said. Well said, Doctor. I can't believe we're down to the wire. We could talk like for the entire day. But one final question I wanted to ask you: where do you see chiropractic care for the next 10 years? I know we discussed the fact that there are some misconceptions or bad perceptions of chiropractors. Where do you see it going like the next 10 years?
That's a great question also. My vision for chiropractic in the future is that we will achieve my practice's mission of saving the United States of America $1 trillion per year on healthcare costs. Chiropractic has been proven to decrease the amount of surgeries that people have. It decreases immobility as time goes on. It decreases the need for pain medication. It decreases the deaths associated with pain medication. Not to say that medication is bad. I had to go on some pain medication last year when I had kidney stones. No fun. But chiropractic decreases those things because it increases your body's ability to function. And that's going to decrease the amount of healthcare expenses in this country that are currently on average per person per year around $11,000 per person per year. And so if we save that and decrease that, that means people pay off their mortgages faster. It means people put into their kids' college savings fund more. It means they start that charitable foundation. It means they get out of consumer credit card debt. It means that they can give to their church. It means they can donate to their son's little league baseball team to get new uniforms. It means they can go on vacation. They can give bonuses to their employees. Or it means they can do other stuff with that money rather than putting it into healthcare expenses. And healthcare expenses is the number one cause of bankruptcy in this country. So I believe we're decreasing bankruptcies. Money fights and money problems is the number one cause of divorce in this country. So we're decreasing divorce. Putting a rock into a pond has ripple effects. Increasing the health of this country is going to have a ripple effect in many ways that we will never be able to quantify in the time that we've got. But I believe it will bear out in the health, not only of the financial health of this country, but the health of this country. And I believe we will regain our position as the number one country in the world as far as providing healthcare, longevity, the effectiveness of that healthcare, mobility, decreasing comorbidities, decreasing immobility, decreasing disability, increasing the function of the family unit, and leading the way for the world to follow the United States of America like they used to, rather than us falling behind and following other people.
Fantastic.
So I believe that chiropractic has all of those benefits. And it starts with impacting that one person's life and respecting their time, respecting their education, and respecting them as a person, and giving them the honest truth about what they need.
And Doctor, I like that vision for your practice and for chiropractic. And almost sure, I know you're going to advance it even more as the incoming president of the GCA. And again, congrats on that. And thank you so much for joining me today. It has been a pleasure. I know our audience, they received some great nuggets from you and, some great information about chiropractic care and how it's important. So I want to tell our audience, how can we reach you? Someone listening in, they're like, hey, I want to go see Dr. Ben immediately.
Well, that all depends. So if you're a chiropractor or a business person, you can reach out to me. I'm more than happy to chat with anybody anytime. I like to develop relationships that are lasting. And I will take anyone's call. If I'm with a patient, I'll call you back. I will not leave the office until I've returned all of my communication, or at least before I start work the next day. So if you want to chat and connect about business matters, if you want to chat and connect about chiropractic in other states or in this state, I'm open to that. I like to be a resource for people. You can call me here at the office, 770-599-7139. If you're an email person, drmcdowell@mcdowellchiropractic.com. If you're a Facebook person, @McDowell Chiropractic. If you're an Instagram person, @McDowell Chiropractic. If you're a LinkedIn person, Ben McDowell on LinkedIn. If you're a Twitter person, @McDChiro. If you're a snail mail person, 1570 Holcomb Bridge Road, Suite 550, Roswell, Georgia, 30076. It's easiest for you, reach out to me and I'll be your huckleberry. I want to make it easy for you in communication. If you're a patient, reach out to us anytime. But I'm open to anyone, anytime that ever wants to chat about anything. Just be nice and be respectful and we'll get along just fine.
Awesome, sir. Thank you so much again for joining me on the podcast. It has been great. And until we meet again, thank you so much.
Thank you so much for joining us for this episode. Please visit our website at yourcompanyhealth.com. Also, you can listen to us on your favorite podcast platforms. Follow us on social media at Your Company Health. And lastly, subscribe to our YouTube channel for new episodes and highlights. Until next time, stay safe.